Made it.
Good afternoon, everyone. Welcome. Thank you for joining us for the 2026 Radiology Health Equity Coalition Partners Meeting. I'm Raymond Tu. I'm a member of the AMA Council of Science and Public Health here in Washington, D.C. as chairman of the board of the Medical Society of D.C. And it is a pleasure to be with all of you today. As always, we appreciate our coalition partners for continuing champion equality. Your dedication is critical to the work we collectively address for long-standing barriers to care for the historically underserved. Today, we have the honor of hearing from a leader whose work is shaping the national landscape of population health outcomes. Hannah Seoh, AMA Vice President of Performance Operations and Interim Lead of the AMA Center for Optimal Health Outcomes. She's a founding member of the center and has been instrumental in driving its growth, shaping national strategies, and leading programs for communities who need it most. Before joining the AMA, Hannah served at the New York City Department of Health and Mental Hygiene, where she led groundbreaking research on health inequities, serving nearly 8 million residents. We are thrilled to have Hannah with us today. Hannah, take it away. The floor is yours.
Thank you. First, just want to thank Dr. Tu, Dr. Smetherman, and Carla for inviting me here today to speak with you all. And as much as I'm here to share with you all what AMA is doing, really also want to hear what ACR has on the horizon and how we can best partner going forward. So very excited to be here. Next slide. So for the agenda today, I'll talk about how AMA is meeting the moment. I'll share a little bit about some new centers and initiatives that AMA has announced recently. And last but not least, we'll share what we have coming up for the Center for Optimal Health Outcomes. Next slide. So I don't think it's lost on anyone how difficult a year it was in 2025. And although many of the attacks were on DEI, we know that it also had effects and impact on the field of health equity. And we know from these public health frameworks, such as the vital conditions for health and well-being, that many, many external factors influence a person and community's health. For instance, housing, transportation, employment, and just basic needs for health and safety all matter. The AMA has been very vocal on changes that the administration has made, such as changes in the vaccine schedule. However, the AMA is also looking for opportunities for alignment with the current administration so that we can be at the table for important conversations that we know will impact the health of the nation. We know that many of these changes have the potential to have significant impacts on the underserved and under-resourced communities, which many of us are entrenched in and care deeply about, as Dr. Tu also mentioned in his opening remarks. So it's important to be part of the conversation. AMA recently released a press release on the recently announced dietary guidelines from the administration. And while we don't agree wholeheartedly with everything that is there, we do agree that food matters, how the food system impacts health. And it's important to figure out how to improve food, not just in grocery stores, but in hospitals, schools, and prisons. Next slide. So you may be familiar with AMA and one of its cornerstones being its legislative influence. I've heard many stories of a time where there wasn't a single health policy that would pass in Congress without AMA's input. And here in the DC office, that's what our focus is, to continue to engage with Congresspeople, go on Hill visits, talk with the administration. And through its advocacy and lobbying efforts, AMA continues to support doctors in improving the health of our nation. These are just some examples of where we are focusing those legislative efforts. AMA has a very robust House of Delegates policy and process by which these policies are set that guide the direction of the organization. And beyond advocacy for food and nutrition, for example, the AMA drives policy across these other areas. So everything from AI and augmented intelligence to community health, medical education, physician wellness and burnout, scope practice issues, and many more. Next slide. So last October was the first announcement. Our CEO actually jokes that a year ago, the question he would often ask is, how many people have used ChatGPT? And just a year later, the question is now, how many times today have you used ChatGPT? And we know that technology advances rapidly. And now with the increasing widespread use of AI and other tools, there will be significant impacts on healthcare and our communities. Because AI has the power to either close gaps or widen them if physicians don't get involved. So this is one of the reasons why AMA announced and created the Center for Digital Health and AI. It was launched in October of 2025 and has 4 primary focus areas. The first is policy and regulatory leadership. So working with regulators, policymakers, and tech leaders to shape benchmarks for safe and effective use of AI in medicine and digital health tools. The second is clinical workflow integration. So creating opportunities for doctors to shape how AI and digital tools work within clinical workflows to enhance, not hinder, the patient and clinician experience. The third is education and training. So being able to equip physicians and health systems with knowledge and tools to integrate AI efficiently and effectively into their practices. And finally, collaboration. So building partnerships across tech, research, government, and healthcare, bringing these sectors together to drive innovation that is really aligned with what patients need at this moment. And there's clear excitement among physicians about AI's future. Recent AMA surveys show that roughly 2/3 of physicians have incorporated AI or digital health tools in some form into their practice already. On the flip side, however, about 1/4 of physicians remain more worried than excited, recognizing potential risks to data privacy as well as reliability and safety concerns. And I hear this a lot talking to a psychiatrist, for example. The new Center for Digital Health and AI has the potential to capitalize on this growing enthusiasm and also allay these concerns that we have. AMA has also realized that it had an opportunity to build more public awareness for what AMA does and really lean into the fact that by and large, the public and patients trust doctors. AMA wholeheartedly believes that physicians should be the trusted source of information when it comes to medicine and science. And data shows that 89% of patients agree that the doctor-patient relationship is central to healthcare. And 79% of patients agree that the red tape bureaucracy makes it harder for physicians to provide the best care to patients. So AMA launched this campaign, Your Care is at Our Core. 29 state medical societies are actively participating in this campaign, and that number is growing. The goal of the campaign is to remind the public, which includes state legislators and regulators, of who physicians are and the sacrifices that they've made to become physicians, to remind patients that physicians are on their side always, fighting alongside them to ensure they get the highest quality of care in this changing healthcare landscape. And the campaign highlights that sacred bond between physicians and patients, which is critical given the current erosion of trust in science and medical institution. So we also have a QR code here, and you'll get copies of the slide afterwards to learn more about this campaign and join on. Next slide. AMA has also recently announced 2 grant opportunities. The first is the State Advocacy Accelerator Grant Program. So this gives physicians targeted resources to drive state-level action to put patients first. We're working hard in terms of the federal environment, but have found that oftentimes at the local level is where we can have short-term gains and wins. So we surveyed the state medical societies, and 64 of the medical societies highlighted what they're concerned about. And these will probably sound familiar to this group as well. They include scope of practice battles, Medicaid pressures, and growing concern about the physician workforce crisis. Next slide. The second opportunity is the Community Health Impact Lab microgrants. This is a program that is going to award a total of $1 million in the form of 20 $50,000 microgrants to physician-led initiatives in community health. So these microgrants are really designed to support physician-led solutions to address health challenges, particularly faced by populations with limited access to care. Promote creative, practical interventions that are designed and led by physicians, and to identify scalable ideas. We want to surface these promising approaches that could be expanded or replicated to other jurisdictions and benefit other communities. The applications are live. The deadline is March 1st. We are hosting a second informational webinar on February 3rd at 3:30 Eastern, 2:30 Central. And the registration link can be found by scanning the QR code or on the AMA website using keyword community health microgrants. So, as mentioned, I'm currently serving as the lead for the Center for Optimal Health Outcomes. This was a result of a merger with another business unit within the AMA, the Improving Health Outcomes Unit and the Center for Health Equity. And really, it was about combining the clinical expertise with the community engagement to really ensure that we're having strong, measurable impacts within healthcare and health outcomes specifically. So the center strengthens and amplifies AMA's work that is leading this transformational change in healthcare. We really want to ensure that we're building healthier futures for every individual and community in the U.S. And COHO supports healthcare organizations and physicians to create and expand programs and solutions to improve health outcomes. We're anchored in a deep understanding of the differences in health outcomes, the importance of meaningful community engagement and physician leadership to develop and drive these measurable actions. Our work is organized under these four interconnected pillars: community health impact, research, health systems engagement, and policy development. And we really can't have one without any of the others. So within the community health impact arm, we have two flagship programs that I wanted to highlight. The first is Release the Pressure. This started in 2019, also when the center was created, and it combines tailored promotional and educational materials with a national campaign that raises awareness around high blood pressure. It increases clinical linkages and amplifies physician voices to reduce the burden of hypertension across the U.S. It also equips patients with tools and resources to self-monitor and control their blood pressure. Pictured here, you can see an activation at the Congressional Black Caucus's Legislative Conference. We've really found Release the Pressure to be a great conversation starter to get our foot in the door with different legislators, as hypertension is still the #1 killer in the US. The second initiative is Westside United. So AMA over the last 5 years has invested $5 million into the west side of Chicago. The west side communities in Chicago face a 10 to 20 year life expectancy gap compared to more affluent areas in Chicago. And we continue to strengthen and build this relationship with Rush University Medical Center, and the funding advances local initiatives in Chicago to address these social drivers of health by creating employment opportunities, deepening and expanding those clinical community linkages, and increasing capacity at different community-based organizations in Chicago. Very excited to announce this website actually just went live today. We have a 4th cohort underway of the Medical Justice and Advocacy Fellowship. This is a partnership that we started with the Morehouse School of Medicine's Satcher Health Leadership Institute. We are also doubling the number of fellows this year. So up to 20 fellows will be chosen to participate in this unique learning framework, receive mentoring and training that equip fellows with foundational skills, tools, and knowledge to engage in institutional and political health advocacy. These fellows, over the course of roughly 18 months, produce capstone projects to reflect how they worked to advance equity across their institutions and their specialties. In terms of supporting health systems and engaging with health systems, we really support in using our suite of AMA map solutions. These solutions are all designed to achieve improvement in clinical outcomes. And when we meet with health systems clients, we actually tailor them to meet the needs of each healthcare organization. So depending on what metric they're looking at, days to readmission, for example, we're proud to have supported hundreds of healthcare organizations in a broad portfolio of clinical settings that include multi-state health systems, academic medical centers, safety net clinics, and critical access facilities. All right. So COHO also works with others across AMA to develop and produce resources that physicians can offer their patients. These are just two of the most recent resources that were created that focus on hypertensive disorders of pregnancy. Maternal health is a strong area of focus for COHO and the AMA and on the Hill. And so these are about patients actually measuring their own blood pressure during and after pregnancy. These resources we always design for literacy and inclusivity and support our work in improving maternal health for all. And we are currently in the process of translating these into 18 different languages. We also curate educational programming for the AMA's EdHub, which offers a wealth of resources, courses, and curated educational content to support physician skill building. I'm aware that the Coalition and ACR also have a page up on EdHub to support radiologists and their continuing education. So this last year, we made significant progress in elevating disability inclusion in medicine and medical education. And this is evidenced by this special supplement in academic medicine. We developed a collaborative interdisciplinary advisory group of stakeholders and subject matter experts. And we will also be launching a dedicated series on disability inclusion in medical education and also how to care for people with disabilities on EdHub later this year. And that is all I had to share with you all today. We encourage you to scan the QR code and learn more about other initiatives that the AMA has. And I'm happy to answer any questions folks have.
Well, thank you, Hannah, for that really great presentation and telling us about the Center for Optimal Health Outcomes, COHO. We are really just honored to have two distinguished radiology leaders here at the table in Washington, D.C. on 25 Mass Avenue at the AMA DC office. Dana Smetherman right here, CEO of the American College of Radiology, and Dr. Jacqueline Bello, past chair of the ACR Board of Chancellors. So let's begin with our fireside chat. So Dana, you heard Hannah's outline of a national approach for advancing health equity. What resonated most with you? And how can we collaborate with the radiology community and the coalition?
So, honestly, so many things in the presentation resonated with me. I love to hear about their new digital and AI center. We are fortunate at the ACR that we began on that journey a while back. About 2017 is when we founded our Data Science Institute. Obviously, the penetration of AI in healthcare has been the greatest if you look at the number in radiology, although we always have to remember that most of those algorithms are triage algorithms, as they were approved, not necessarily for detection. But I think we were also fortunate to realize pretty early on in our journey that we were going to have to embrace AI as a specialty, not be afraid of it, but actually learn about it, learn how it could be used to improve access with lots of different things. Like every other modality, where we have come in and tried to develop standards of how to use it safely and effectively for our patients. we have undergone a similar journey for AI. We started out with what we call AI Central, which is the largest repository of AI products and imaging. We list all of them that are AMA approved, and we invite all of them, and some have taken advantage of it, to be declared transparent AI, which means that they disclose what populations they've been tested on, et cetera. So that's the first thing. The next was what we call RHEC, which is a recognition program where radiology departments can go in and see if they have really the building blocks in place to institute AI in their practices. Some of the things are very basic that you don't think about, but what problem are you trying to solve by putting AI in your department? Do you have the governance to be able to handle it? Do you have the right people involved in the decisions? And then we also started just a little over a year ago what we call Assess AI, which is the first national registry for post-marketing surveillance of AI products. We are on the journey to be able to provide accreditation. And one of the things that excites me most as we think about it in the context of access and underserved populations is that we very intentionally have built the registry on the backbone of our ACR Connect platform, which is what we use for our other registries and for accreditation. And so, the vast majority of mammography facilities in the United States have ACR accreditation. And so we built on that same platform because, making sure that, to your point, we don't worsen disparities in AI and that the opportunities are available to everyone. So that was one thing, just, because that was one of the earliest slides. I think another thing we always have to remember with imaging, and it gets forgotten, is that diagnostic radiologists provide more Medicare services to patients than any other specialty. Imaging touches the patient journey at so many different points. And I think there are always tremendous opportunities as we think about access to try to make sure that we take advantage of those interactions. So, and I'd love to hear, I don't know if you were going to ask Dr. Bello similar questions or.
Well, Dr. Bello's out there in cyberspace, but one of the things I really want to hear from Dr. Bello is you heard Hannah's vision, but how does it align with priorities and opportunity in the radiology space, Jacqueline?
Well, thank you. And thank you, Hannah. And Dana opened the door for a comment I'm about to make that I think as CEO, she's probably not allowed to. But if you remember my introduction, it said former board chair. Hannah, that Data Science Institute that was begun, prescient, in 2017, the FDA, Hannah, has us on speed dial. Now, I don't think Dana's allowed to say that, but I just did. And I want to emphasize that it really is a privilege. Dana mentioned how frequently, how often we touch patients in radiology, despite the fact that CMS insists on calling us non-patient facing. But 40% of visits to one's physician involves medical imaging in some way, shape, or form. Mrs. Smith, I understand your pain pattern. We are going to need to get a scan. Mr. Jones, your scan showed this. The reasonable next steps would be this. Mrs. Smith again, different Mrs. Smith, common last name. So we are going to suggest you now engage with another aspect of radiology for treatment, our radiation oncologists. So we can use x-rays to find problems, and we can also use x-rays to help treat you. So not to belabor it, but with that privilege of touching patients comes the responsibility. So again, Dana, thank you for bringing up accreditation. My other disclosure, Hannah, is prior to being board chair, I guess because of my bad behavior, I was chosen for board chair, but I did chair the ACR's Commission on Quality and Safety. And I am here to tell you that MQSA legislation was the best thing that ever happened to this country because it launched the whole concept of the need for accreditation. Hannah, you mentioned in your presentation the fact that the social contract, my words, not yours, that we have with patients. You mentioned patients' trust. You mentioned having empathy and compassion to preserve that trust. Well, with every privilege, the privilege of interacting with patients comes responsibility. And accreditation has moved mountains. I can tell you of stories of angiographic studies where the head looked like a shrunken head in the middle of a film. And that just is not going to diagnose anything other than the fact that that patient, Smith or Jones, does have a head. And unless we insist on quality and standards, that trust evaporates. It just evaporates. So I think that recognizing the privilege and the responsibility, and then recognizing the central role we do play. I chose radiology because I wanted to do everything. I wanted to do everything. And so you touch older populations, younger populations, males, females. You touch surgical disease, you touch medical disease. And at each point of the way, I tell my residents, if you can't provide value added, there's no point. I'm a neuroradiologist, and so it's no longer good enough to look at an MRI of the brain and say, bright dot, right spot. Well, that's terrific. And guess what, folks? AI can do that for you. And then AI can list the 22 different things that that bright spot might be. But the Dr. Tu's, who is also a neuroradiologist, will be able to provide in Mrs. Smith with that history based on the clinical presentation and prior imaging showing stability over time. This is the favored diagnosis, with next steps being perhaps nothing. Cha-ching, cha-ching, you just saved money to the system. And I'm known as a radiologist who has ended a report. Now, yes, I practice under an umbrella, some people would call it, of being an academic medicine. But I have ended reports with, as this is the 5th normal CT of the head in this young patient without clinical change in condition. Further scanning might be deferred. That sentence perhaps would get me fired from some private practice across the park from where I am over on the east side. I didn't mention any names. So it is really a prized opportunity. And I'll just end with what resonated with me was your recognition that, yes, Hannah, we were the first specialty to collaborate on the AMA Ed Hub. And I'll just put one more hat on for a minute. Former chair of the Council on Medical Education. That's what it's all about. Education. Thank you.
Thank you, Dr. Bello. Whew.
What has Dr. Bello done a lot of things more?
She has done a lot of things, and this and that's a good segue to the next question for you, Dana. You know, the ACR has been the cornerstone of the Radiology Health Equity Coalition, and we're talking about opportunities to collaborate here at 25 Mass Avenue and Union Station, just down the street. What are some opportunities with collaboration with the AMA?
I think we actually have tremendous opportunities to collaborate with the AMA. Mentioned the Ed Hub. I was delighted at the last few AMA meetings that we were able to hold an educational session that was about AI. Last year, we did one that was about lung cancer screening, a woefully underutilized tool. So that's some things. We also, I'm very proud, and again, Dr. Bello has certainly been instrumental to this, in how we have grown such a very robust radiology coalition, right? The Radiology Section Council and the ACR delegation. We're very involved. And I think sometimes people are surprised a little when they get on a call, sometimes the candidates with the Radiology Section Council, they see 75 to 80 people. So I think we're there, and I think we are starting to have people in leadership positions, even more than when Dr. Bello was in hers. I also think as we look out in just communities, and I loved how you talked so much about communities. Oftentimes, and I think I've underestimated this in my career, the role that healthcare can play in those communities, whether it's outreach or some of the things that I did in my career before as a working physician. Whenever we built a new primary care clinic, we embedded a mammography screening unit in it. Because what we found was that some of the barriers for patients to actually be able to get their screening tests were the fact that they just couldn't get off of work to go back for another appointment and have to get childcare and have to get transportation. So if you could maximize that interaction while they were in your hands, what power that had. So by being able to get their imaging, able to get their labs, et cetera, et cetera. I think another really interesting thing as we think about that model and being a part of the communities is how I really do think with what they call opportunistic screening. I don't love the word opportunistic, but we're going to be able to diagnose preclinical disease that we probably never envisioned. And that's things like a patient has a CT of the chest and abdomen for something unrelated, and we use that to screen for osteoporosis. Or on mammography now, we're getting much more sophisticated about using that to predict vascular disease because they're looking for breast cancer. So I think partnering with radiology to increase the awareness of, I think, the previously not really considered role that imaging can play in population health and in preventive care. I mean, I don't think anybody would have envisioned that, 40 or 50 years ago. In fact, I've done some, Dr. Bello mentioned MQSA, and I educated myself a little bit about why it was such a struggle that we had to pass legislation to get coverage for mammography, et cetera, et cetera. But when I looked at it, and I was speaking with a colleague, and he said, well, I think you need to go back and look at when, the Social Security Act was founded. And he was right, because in 1965, there really were no meaningful tests to detect preclinical disease in the Medicare population. So my point is, I think just to help us increase awareness and patients' awareness of all of the different opportunities that I think imaging is going to provide for population health in ways that nobody might have envisioned us to.
Jacqueline, Dr. Bello, you have ACR, you have AMA, you have the Radiology Health Equity Coalition here all together. How do you see these partnerships can really accelerate and create progress towards equity from where you sit?
So we have several examples, just focusing on collaboration in general, several examples where collaboration in areas that Hannah outlined are prime on everyone's mind. Scope, okay? What about the No Surprises Act, the coalition that was built with anesthesia and with emergency medicine? What about the huge coalition that over the course of 3 years restored billion in revenue in terms of the Medicare physician fee schedule simply by its multiplier effect. So when you use the word accelerate, Ray, what you need is a multiplier. And that multiplier comes through coalitions. And the benefit of the two organizations, think of their structure. AMA has a House of Delegates with state representation and specialty representation. Okay. Dr. Smetherman mentioned the size of the Radiology Section Council. People like me represent their specialty there. American Society of Neuroradiology, as you know. Others come from the states' medical societies and their leadership. So again, this kind of multiplication of effort will accelerate any initiative. And finally, Dr. Tu, I'm going to choose to embarrass you. How we can accelerate progress. You all are sitting on Massachusetts Avenue, okay? Dr. Tu started an initiative for lung cancer screening whereby infographics were posted in bus stops. Okay? So for a non-facing, patient-facing specialty to try to encourage screening, number one, work with the AMA where we have primary care folks and specialists who see these patients. And if we're speaking with one voice, we don't have to share opinion, but we can share purpose. If we're speaking with one voice, that trust multiplies.
I would add one
And
other thing.
we're, I'm sorry. And
go finish, Jack, please.
No. And we're meeting the patients where they are, whether it's the bus stops or Carla was speaking earlier, pre-going live, about the uterine fibroid embolization effort. Dr. Shukla created a YouTube video. That's where people are. They're doing this all day long. So acceleration requires multiplication. And I can teach anyone that math who doesn't get it.
I was just going to add, as we talk about collaboration and people working together, I just wanted to point out the power of this, the Radiology Health Equity Coalition, because we have many of our colleagues from other imaging societies who are part of the Health Equity Coalition on the call, and the importance of all of us working together, to your point, Jackie, about, having a common purpose. And certainly in this particular arena, as a non-patient facing specialty, to still have the patient at the center of everything that we do.
I agree. And the proof is in the pudding. We're in person sitting here at the AMA office with the CEO of the ACR. I mean, it doesn't get more real than that, honestly. So
Raymond,
Hannah, yes, ma'am.
No, I just want to add one other thing. And that is, Dana mentioned the multiple specialty societies who are on the call and who work with us as partners. Hannah, guess who else is one of the first members, founding member of our mobilization team? The CEO, the American Board of Radiology. And when its CEO initially said to me, well, is that really our wheelhouse? Council on Med Ed had, I said, oh, do you remember part 4 of continuing certification, professionalism, and improvement? Right? Enough said. And he has a beautiful quote that I won't prolong my input by saying, but he's the one who mentions that it is a crucial extension of the social contract that we have. The ABR is saying this to promote the best possible care to the broadest range of the population. Now, you tell me because I did represent the AMA at the ABMS Committee on Continuing Certification. You tell me what specialty doesn't want to get rid of the toothache for practice improvement initiatives. How about putting something on EdHub that does just that by emphasizing professionalism through attention to social drivers, improving access, and, oh my, outcomes?
Thank you, Jacqueline. Hannah, from the AMA's perspective in the House of Medicine, how does the Radiology Health Equity Coalition strengthen what's happening with the community health efforts? And where do you see some greatest potential for synergy?
Yeah. Well, first of all, I'm really excited at what has already been mentioned by Dr. Smetherman and Dr. Bello. I think we are prime, even with our new leadership within AMA and the new CEO, and his strong focus on AI. He often talks about, we need to come up with the solutions and then utilize AI to help further those solutions instead of waiting around to see what AI can do. And it sounds like ACR has been ahead of the game on that. So really excited to partner and learn more about how the Digital Health Center within the AMA could be aligned with what ACR is doing and what you all have learned already. I think EdHub also is a great opportunity to continue to partner with educational modules, and not just education, but also research that could pair with that education. So we've worked with certain other specialties who may not have as much capacity to understand, okay, what are the issues that their physicians most care about, and utilizing our AMA resources and expertise to help further that research. So partnering on research studies, publications, to get more information out into the field that is critical, with the AMA's name behind it. AMA also has great convening power, and it seems that ACR has done a good job of that as well with the Radiology Health Equity Coalition. It's very clear to me just from hearing both Dr. Smetherman and Dr. Bello speak, the incredible passion that exists. It's very clear that this group cares about patients, and has to fight through a lot of narrative about this nonsense about non-patient facing specialty. All specialties are patient facing, and doctors do not become doctors unless they care about making patients healthier. So really would like to think through any kind of campaign ideas, marketing ideas that you have that could combine or have synergy with our existing AMA campaigns and social media efforts. We're starting to be a little more present on LinkedIn, Instagram, still not on TikTok yet, but maybe that's coming. But Dr. Bello, you're right. There's not a world where we can ignore social media, and there's a lot of opportunity there to reach audiences with our messages. And then also just policy again. It's good to hear that the priorities that we thought were priorities are also priorities with ACR in terms of scope, practice. Medicare and Medicaid are, big areas of concern that we're watching and doing research on and hoping to advance policy wins at the local level at. And ultimately, we know that the communities that are most underserved, most under-resourced are going to suffer the most. And honestly, I think the narrative around Medicaid could also change. Any one of us are, one unemployment away from having to need Medicaid. So I think there's a lot of work and partnership we could do in that area as well. And overall, I love this idea of coming together, collaborating, sharing resources, and being unified and speaking with one voice. I really do believe that physicians are the source of improvements in healthcare, and how to improve not just quality patient outcomes, but also affordability, accessibility, and by coming together and having conversations like this, like we're moving in that direction. So I'm very hopeful for the future.
Hannah, what motivates you to stay committed to this work?
It depends on the day. But really just, I've always felt that I wanted to make a difference and impact, and continuing to have conversations. Like I said, you can't become a doctor without caring about the world, making an impact, making a difference. And it's a profession where, like, by and large, I think everyone carries that central core mission that they want to help. And they want to leave their mark, leave the world a better place. And whatever they can do in their power, they're going to do that. I don't know I've yet to meet a physician that isn't involved in like 5 different organizations, sits on this board, also supports their family and the PTA. Like, you're all extremely committed group of individuals, and I can't think of a better group to work with to make the healthcare system actually work for everybody.
As a CEO of the American College of Radiology, you are pulled in so many different directions. But what motivates you, Dana, to stay committed to this work?
It actually, I was sitting here listening to Hannah and thinking to myself, I went through a lot of different roles as a physician, and then as a physician leader, and then a year and a half ago, making the decision to take on this role. And, I've been involved in many different organizations. That's how I met Dr. Tu. But I think it is the idea, as you said, Hannah, of being able to have an impact in a different way, for a larger group of patients. And many times in my career, it was the patient right in front of me. Other times it might be outreach to the patients in this community. And so I think trying to always remind yourself that at the end of the day, it does come down to that one individual patient, even if you're now in a role where you can have an impact on a much broader scale. So, it's been fun, right? I mean, you think about the many friends that you've made along the way, patients that you've helped, people that you meet. And even, I've done things as have both Dr. Tu and Dr. Bello, with the AMA CPT editorial panel and the RHEC. And that was another thing that I did. Speaking of payment policy, like, well, this would be a way to have an impact that's different, but might be on a broader scale. You can really make a big difference. So I think just getting up every day and reminding yourself of that. But you're right, it's different every day. Not every day is as easy as the one before it. But and I actually love groups like this, because all of these problems are bigger than each of us.
Yeah.
And so, we're going to need lots of people with lots of good ideas to be involved, to continue to make things better for patients.
Dr. Bello, my mentor, my friend, you are so involved in so many things. But my question for you is, what motivates you to stay committed to this work?
So, Ray, you know that I drive to work from Manhattan to the Bronx, the poorest urban county in this country, not just New York State. If you take away urban, the answer is Appalachia. So my answer to your question is, today's patients motivate me. They're sicker sooner, they die younger. And part B to my answer is tomorrow's doctors. Because I've sat on the medical student admissions committee to the Albert Einstein School of Medicine. First question I would get. Do you have a free clinic? When do you allow the students to go into the patient-free clinic? Okay. Hannah used the fellowship for justice and advocacy. Okay. They get it. I sit on the resident selection committee. How involved are your residents in the community of the underserved? I love these softballs. I mean, Montefiore's in the schools. Montefiore was the first place to have a visiting nurse program. Don't all shake your heads. Let me finish. In psychiatry. In psychiatry. And was able to prove the adherence, release the pressure, Hannah, the adherence to chronic condition meds like hypertension and diabetes based on having infiltrated the community with, where necessary, with home visits in psychiatry. So it is the community involvement that I think our next generation is getting. And I think they're driven to it because, here's a factoid for you, a significant percentage of medical students, fasten your seatbelts, are on Medicaid because that insurance is cheaper than whatever university ABC or college EFG is offering. So they understand that kind of a crunch. That's what motivates me. Today's patients and tomorrow's doctors.
Well, you'll be happy to know, Dr. Bello, that on the table here in front of us, we have T-shirts for the Communities Crushing Cancer initiative.
A resident-driven
Yes.
project.
Right, including
Wonderful.
their beautiful logo. And so anyway, yes, as you talk about the future of healthcare and the next generation. So
Wonderful.
yeah.
Send me a small.
We'll do, Dr. Bello. I'll mail it to you this week.
Well, I just want to just say thank you to all of our coalition partners, everyone smiling on the screens. I can see you all for joining us on this ongoing engagement for the shared work. I really want to thank the team, particularly Carla over there.
Oh, Kevin.
Come on, Carla, you gotta come on.
Take a bow, Carly.
Hi, and there's Carla for really putting this together and making us look stage presentable. And Brianna's gonna circulate a poll for the next meeting. So thank you again for being with us today, and we look forward to seeing you next time. Bye-bye.
Hi, thank you.
Thank you, Dr. Tu.
Bye-bye.
Thank you, Hannah.
Bye-bye.